Dr. Antolak, what are the different diagnostic tests an IC patient can take to see if they have painful nerve inflammation?
It's very simple. The doctor has to suspect the possibility, and most doctors aren't aware of the existence of pudendal neuropathy. The simplest test that any doctor or nurse practitioner, any practitioner can do is a pinprick test in the pudendal territory. In the female, I touch the medial thigh and compare that to the touching of the labia, the clitoris, and the anal sites. And 92% of my patients, whether male or female, will have either hyperalgesia, that is more response to pain, pinprick, or hipalgesia, that is less response to pinprick. And those people then have a diagnosis. I do two additional tests. One is a quantitative sensory test called warm detection threshold, like when you measure your finger in the, or test the water in the shower with your finger. That test is 92% abnormal. And then we do a test, the French taught us, but is done in this country by colorectal surgeons. It's called a pudendal nerve terminal motor latency test, which tells how fast a signal goes along the end of the tail end of the pudendal nerve. Well, that's abnormal also in up to 60 to 80% of patients. So those three tests with a consultation within an hour will make a positive diagnosis.
And then once an IC patient has that diagnosis, what are the next steps they can take to treating this condition?
This is a pudendal neuropathy is a compression neuropathy. It's very similar to or analogous to the carpal tunnel syndrome, where you must wear a splint, where, for instance, my daughter needed injections, and some people need surgery for carpal tunnel syndrome. Well, that's the same as pudendal neuropathy. The splinting is to avoid sitting. If you must use a sit pad with a center cutaway. Medications, of course, I like amitriptyline, which is very effective for bladder complaints and nerve pain. And gabapentin or Neurontin, a very effective treatment. That's the self-care program. If you're from my local area, I would have you use that for 8 weeks, and then I'd see you back. And about 10% of my patients are cured just with that. Then the next step in treatment is to inject steroids and local anesthetics around the nerve. The French showed it very effective to do that 3 times at 1 month intervals, and we have thousands of symptom scores that also indicate the improvement with that treatment and cure. My cure, the longest one, is 11 and a half years. That's a man I still follow from the Mayo Clinic. The third treatment, and which is about 30% of my patients, is a surgical decompression of pudendal nerve. There are different styles of doing it, but the technique I use is from the city of northern France, in northern France called Nantes, and it's very effective. 65 to 75% of patients are cured or near cured. I gotta caution people that there are multiple pain generators. 64% of my patients have Main syndrome, abdominal cutaneous nerve entrapment, ilioinguinal neuropathy, middle cluneal neuropathy, perineal branch of the posterior femorocutaneous nerve neuropathy. There are other neuropathies that can affect this territory, so failure of pudendal decompression may only mean that these other neuropathies also need treatment. So that if someone walks into my office, about 92% of them over a period of months will have cure or improvement. The other 8% have serious nerve compression. And I have many photos from surgery showing terribly damaged pudendal nerves.
If a patient wants to see a healthcare provider to know if they may have this condition, would they go to a urologist or a pain specialist? What is your opinion on this?
There are very few physicians who do consistent work with diagnosis and treatment of pudendal neuropathy, so there's a real challenge there. Most of my patients come to me online, from finding out about this online, Often their doctors are incredulous when they read the material handed to that the patients bring in. So they must be aware of it and then seek out somebody in the U.S. Who treats this. And there are organizations such as the Pudendal Neuralgia Foundation, the Society for Pudendal Neuropathy that sponsor websites where patients can go and find knowledgeable physicians.
Okay, thank you so much, doctor.